So this is Marcus. He is a 9-year-old rescue cat. I rescued him from the SPCA, but prior to that, he was a barn cat in Saskatchewan. So I am expecting to see a little bit of pain when I hook up the PainTrace device, just because of his past life. Right now, he is hooked up to the PainTrace device, and you can see cables running on either side of him, and those are attached to sensors that are placed within the axilla, and the PainTrace device is just behind him. Now that I have started the PainTrace, we can immediately see that there is some chronic pain. So we can see this by looking at the baseline relative to the y-axis. Here we can see that relative to that y-axis, that the baseline, which is in blue, is negative and it's hovering around negative 0.6. So this is indicating the presence of chronic pain. So now I am going to use PainTrace to determine the location of pain, and I am going to do this by palpating different areas. So next, I'm going to go in and palpate his hips, a slightly larger acute pain peak. So to move the hip, we're actually seeing this color code orange, meaning that it is moderate acute pain. So mild acute pain is yellow, moderate is orange, severe is red, and anything more painful than that is denoted as extreme pain, and it's color coded black. So the final trace here is showing us the presence of acute and chronic pain. It's also showing us the location of pain because we palpated and manipulated different areas, which showed us acute peaks. Then we can use this information to communicate the need for pain intervention to client, essentially providing a voice to the animal's pain. We can also use it to guide further diagnostics and imaging because of its ability to locate the pain as you're palpating different areas. And it can also act as a baseline of pain to determine treatment efficacy at later appointments. And this is really important for determining whether or not a treatment is truly effective at reducing acute and chronic pain.